Hi, welcome to another one of our Dr. Foot videos. I had a short break, 20 minutes, and I thought, let me make a quick 5-minute video about the patient who I saw yesterday afternoon, which was fascinating, absolutely fascinating. This patient came to me complaining of heel pain. So she came to me complaining of plantar fasciitis. She's been diagnosed with plantar fasciitis for the last 2 years. She's been given stretching exercises by physios, been to other private podiatrists and chiropractors, osteopaths, everybody, you name it, she's been to them. So she's at 3 steroid injections, and she hasn't got better from any of these injections. Why they carried on doing the injections, I don't know. Because if you're not better from the first injection, you don't do a second, yet alone a third. She's at three steroid injections in 2 years. She's getting intense heel pain, and she came to me with the view of either having shockwave treatment or having Prp treatment, which is when we take blood from your arm, we spin it, we separate the red blood cells from the platelets and the healthy plasma, then we re-inject the platelets and the healthy plasma into an injured site. It's got growth factors and building blocks which helps to repair a damaged structure. However, I don't think she had plantar fasciitis, and I don't think she had plantar fasciitis at all. And I think she's been misdiagnosed by quite a few health professionals. I think she had sciatica problems. So sometimes you can get referred pain from the back that can affect the feet. Now, the sciatic nerve is a very thick nerve. And oftentimes, if you've got any lower back problems in the L4, L5, S1 discs in your lower back, that can lead to damage to the sciatic nerve, or rather impingement to the sciatic nerve. You can also get it because of disc problems. So you can get discs that are herniated or that are degenerative, that can lead to it. You'll get burning and tingling sensation often down your buttocks, into your leg, and it can shoot down into your foot. Now, I did a couple of tests on this patient. I'm going to put videos up about these tests. I did a test called the Slump Test, which tests the neural tension in this sciatic nerve. So we get the patient sitting down at the end of the couch, and we get them to slouch down, and then we lift up the foot and we dorsiflex it and see if they're getting any symptoms. We usually do the healthy side that's not affecting the patient, and then we do the other side. And I also did a straight leg raise test, which I'll also put the video up for, which is a similar sort of test, but the patient's lying down and we raise the foot and then we dorsiflex the foot to see if they're getting any tension on the sciatic nerve. Now, she was positive for both tests, and her symptoms were not typical plantar fasciitis symptoms. So she was getting some burning and tingling down from her back into her buttocks, and this was resulting in intense heel pain. So she was getting mild back pain, lower back pain, but she was more complaining about the heel pain. So oftentimes, heel pain is not caused by plantar fasciitis. Now, it is the most common cause of heel pain. It's what I see very often. But you do get cases like this where patients have referred pain from the lower back, and that can lead to intense heel pain, which is why it's very, very important to visit a podiatrist to be assessed. And there's some other big red flag conditions like cauda equina, which is a lot more complex and is something that the patient has to be sent into A&E, and it can also result in foot pain, but you'll also get a lot of other symptoms that can affect the bowel. So the takeaway message is, if you've got heel pain, don't assume that you've got plantar fasciitis. Visit a podiatrist. So I've sent this patient away to a physio who is awesome in Birmingham, who I trust so much. So I've sent her to this physio, and I'm pretty sure that we'll be able to work together to get some sort of management plan for her. Hope you found this video interesting, and I shall speak to you soon. Take care. Bye.